So, we've talked about our immunity as a defense system protecting our body from infection and foreign bodies. But no, this is not a perfect system. Sometimes there's exaggeration, misdirection, confusion, insufficiency, and some of the responses here can be life threatening. So, let's talk about alterations in immunity, Chapter 8. First, let's talk about hypersensitivity. Know that hypersensitivity is an abnormal immunological response to an antigen that causes damages to us, the host. The hypersensitivity can be classified in two ways: by either the mechanism that is causing the disease or by the source of the antigen that the immune system is attacking. Let's get into these. Note that hypersensitivity is an excessive or an inappropriate response of the immune system to a sensitizing antigen. This excessive reaction to the antigen can be immediate or delayed. Immediate reactions occur within minutes to a few hours after exposure. This immediate response is usually caused by antibodies. Delayed reactions may take several hours to appear and are at maximum severity after re-exposure to the antigen. This delayed reaction usually caused by the cells like natural killer cells, T cells, or macrophage. Know about anaphylaxis. This is the most rapid and most severe immediate hypersensitivity reaction. It occurs within minutes. It can be systemic or cutaneous, meaning local. Some of the symptoms of systemic anaphylaxis is itching, also known as pruritus, redness or erythema, vomiting, diarrhea, trouble breathing, and if extremely severe, swelling of the throat, and a decreased blood pressure that can lead to shock or death. What are some things we know that cause anaphylaxis? Bee stings, peanuts, shellfish, sometimes eggs. When there is a cutaneous anaphylaxis, it's similar to inflammation. We may see pain, redness, or swelling. So in the beginning, I said there are mechanisms of hypersensitivity reactions. Essentially, these reactions are caused by different things. You can see here there are 4 different types that are caused by different mediators. Know the types and know what drives them. For example, type 1 is driven by IgE. What do we know about IgEs? These are associated with allergies. That is why an IgE-mediated reaction is called an allergy. What's happening here is that the IgE rapidly binds to the Fc receptors on the mast cells. Remember, we talked about the Fc of the antibody, and it's being responsible for its functions. When this binding happens, the person becomes sensitized. When there is a second exposure or a re-exposure to the allergen, the IgE antibodies then signal the mast cells to release the mediators. Again, degranulation that we talked about. And one of these things that is released in degranulation is histamine. There are large amounts of mast cells in the GI tract, the skin, and the respiratory tract. So it makes sense then that when histamine is released in these areas, it's going to wreak havoc on the body. So what are some manifestations we'll see with this? You can see them up on the slide. GI symptoms that are usually caused by allergens enter through the mouth like with foods or medications. You'll see sometimes vomiting, diarrhea, abdominal pain. Does anyone know what the most common food allergy in adults is? It's actually shellfish. In manifestations of the skin, you'll see hives or urticaria. This is because the histamine is causing vascular permeability, the leaky vessels. It also results in edema with the itching. For the effects on the mucosa, which is the eyes, nose, respiratory tract, we may see conjunctivitis, which is inflammation of the membranes lining the eyelids, rhinitis, which is inflammation of the mucous membranes of the nose, or asthma, which is constriction of the bronchi. These things are caused by vasodilation, hypersecretion of mucus, and edema of the respiratory mucosa. Most often in the type 1 hypersensitivity, we'll see asthma. Allergic diseases of the lungs become a problem because they obstruct large and small airways, causing bronchospasms, swelling, and thick secretions. This is when wheezing and difficulty breathing and other asthma type symptoms start to present. In type 1 hypersensitivities, a person may actually be predisposed to these types of allergies. This is also known as being atopic. When one parent has an allergy, 40% of the offspring are likely to develop allergies as well. If both parents have allergies, that may go up to 80%. Interestingly enough, these people produce higher quantities of IgE, and have more Fc receptors for IgE on their mast cells. So we know anaphylaxis allergic reactions can be life-threatening. That's why it's important to have testing so people can be informed of their allergies and avoid contact with that material. There's testing like food tests and skin tests and lab tests that measure IgE. People can use antihistamines to block the reaction within the body. Here's a visual where you can see the exposure to the allergen on the left, and the antigen presenting cell will present it to the B cell, and with the help of the T cell, a plasma cell will be born. The plasma cell will then distribute antibodies. In the case of the type 1, it is the IgE which meet the receptors on the mast cell. On the right is the second exposure, or the re-exposure. This time the antibodies are already there, and the mast cell will degranulate, releasing histamine, causing the effects of the allergy to be worse. Type 2 hypersensitivities are immune reactions against a specific cell or tissue. They are very driven by the tissue-specific reactions. We know that cells express a variety of antigens on their surface. Some are tissue-specific. They are expressed only on certain cells. Platelets would be an example of this. They have a group of antigens that are found on no other cells of the body. The symptoms of this hypersensitivity will depend on which tissue or organ expressed the particular antigen. They can do this in several different ways. Keep in mind that each mechanism begins with an antibody binding to one of these tissue-specific antigens. One of the ways when cells are destroyed by antibodies and the complement system. We talked about the complement system already. Antibodies like IgM or IgG will react to the antigen, causing the activation of the complement cascade through the classical pathway. An example of this is when someone has hemolytic anemia. What do we think hemolytic anemia means? Hemo meaning blood, lytic meaning lysis. Anemia is a lack of red blood cells. So essentially, through complement, red blood cells are destroyed through lysis. This is usually due to mismatched blood types and transfusions. There is also antibodies that cause cell destruction through phagocytosis. Sometimes there are toxic products that are produced by neutrophils that cause tissue damage. In antibody-dependent cell-mediated cytotoxicity, or ADCC, natural killer cells or phagocytes are essentially broken open by antibodies, and they release toxic substances that destroy the cell. We see this in transplant rejections and immune reactions against abnormal growths. The last mechanism of type 2 hypersensitivity is target cell malfunction. Here, the cell is not destroyed, but it's malfunctioning. Essentially, the antibodies change the function of the receptor. We see this in hyperthyroidism or Graves' disease. Antibodies stimulate the thyroid to produce excessive thyroxine. Type 3 hypersensitivities are driven by immune complexes. These are antigen-antibody complexes that are formed in circulation, and they get deposited into vessel walls or other tissues. Whereas normally the antibody would bind to the antigen on the cell surface, here the antibody will bind to the antigen in the blood or bodily fluid as it circulates. Then it adheres to the tissues. It can choose where it wants to go. Usually we'll see it in the skin, the kidneys, or the lungs. It gets caught up there. Why that's not good for us is because they adhere themselves to the vessel walls and it causes the complement activation. Neutrophils are going to rush in and try to eat it up. The complexes will go through phagocytosis. Remember when we saw the picture of the phagocyte and how it eats something, it becomes a phagosome. Then it gets broken up. Instead of that happening, the phagocyte releases large amounts of its toxic enzymes, damaging the surrounding tissues. The manifestations we will see with immune complex hypersensitivity or type 3 is serum sickness. This is when these complexes are forming in the blood and depositing into the tissues. An example of serum sickness is a certain type of Raynaud's. A person's fingers, toes, and nose may turn white due to lack of circulation. That is because these temperature-dependent immune complexes are getting stuck up in the capillary beds of the circulation of the fingers. Raynaud's can sometimes be caused by these complexes. There's also known what is called as the Arthus reaction. This is repeated local exposure to an antigen that reacts with preformed antibodies. It forms complexes and again will get stuck in the walls of the local blood vessels. Symptoms of Arthus reaction usually begins within an hour of exposure and peaks at 6 to 12 hours. This is what we see in celiac disease. The antigen, which is usually wheat, is ingested and meets with the antibodies in the GI. Complexes are made and deposited along the GI tract, causing an accumulation of neutrophils, swelling, and therefore tissue damage. So you can see in this visual here, these small immune complexes, the Y shape is the antibody, the little circle is the antigen. They float around in the blood instead of being connected to the cell surface where they can be presented and processed. They get deposited into the tissue. Because of that, complement is activated. Neutrophils come via chemotaxis or attraction. And instead of being able to be eaten up by the phagocytes will release the lysosomal granules that are toxic through degranulation, and the end result is tissue damage. Type 4 hypersensitivities are cell-mediated. Types 1, 2, and 3 are mediated by antibodies, so this makes type 4 very different. T lymphocytes, or more specifically the TC or TH cells, produce cytokines that destroy cells directly. This is usually a delayed response happening 24 to 72 hours after exposure. This is majorly delayed when we compare to something like a type 1, which happens within minutes. So why does it take so long? The response is delayed because the time it takes for the T cells to travel to the site, produce the cytokines, and activate the macrophage. So we'll see this in graft rejections. We'll also see this in TB tests, an allergic reaction on the skin. Many of you have had TB tests. So what's happening here is that between 24 and 72 hours, if the body recognizes the tuberculin, the reaction site is infiltrated then with T lymphocytes and macrophage, and that will result in a clear, hard center. That's called an induration, and the redness around it is the erythema. These cells come to kill the recognized pathogen. That means that there's a positive test for TB. So now when you get TB tests, you can impress your nurse because you know what is happening here. If there is a hard lump there, it means that it's been recognized, which means that the person has had a prior TB infection. So which hypersensitivity reaction involves tissue-specific antigens? The answer is B, type 2. Type 1 is IgE mediated. Type 3, remember, is the immune complexes, and type 4 are cell mediated. So now we're going to go over the different types of hypersensitivity reactions. This includes allergy, autoimmunity, alloimmunity, and immune deficiency. So first we'll go over allergy, which refers to hypersensitivity to environmental antigens. These antigens cause a response that is not typical. We'll see this in response to pollens, molds, foods. Sometimes this brings on just annoying symptoms that are common in the type 1 response, things like rhinitis, sneezing, and other mild reactions. But as we discussed previously, some of the antigens can be life-threatening, causing anaphylaxis. Any antigen that causes an allergic response is called an allergen. Bee stings are common type 1 hypersensitivity reactions serving as allergens. 1% of children have an anaphylactic reaction to bee venom. Within minutes, they may develop swelling at the site, followed by hives, itching, and swelling away from the site, like in the eyes or the lips. They may also be flushed, sweating, dizzy, or get a headache. And in more severe cases, they may have GI or respiratory symptoms that lead to shock and possibly death. When someone is known to have a bee sting hypersensitivity, obviously they want to try to avoid bees. If a child has had an anaphylactic reaction, the chance of them having another one is about 60%. So most of these people will carry what's called an EpiPen. It's epinephrine, which reverses the effects of bronchodilation caused by histamine. You may ask why antihistamine is not indicated here. It's because that histamine is already bound and there's already been smooth muscle contraction initiated. Antihistamines block that binding, and since it's already happened, they are not as effective. Sometimes we can desensitize people to allergens by exposing them to minute quantities of the allergens over long periods of time. Keep in mind this may reduce the severity of the allergic reaction, but may also trigger anaphylaxis. So works best for respiratory tract allergens and biting insect allergens. Another type of hypersensitivity reaction is autoimmunity. This is where our immune system does not tolerate our self antigens. For many reasons, the immune system does not recognize our own antigens. Sometimes, however, there is a breakdown of tolerance, and our bodies need to begin to recognize our self antigens as foreign, so our bodies attack. This is when we see autoimmune diseases like lupus. On page 182 of your book, there's a table that gives examples of many autoimmune diseases. So let's talk a little bit about SLE or lupus. It's the most common and most complex autoimmune disease. What's happening here is a large amount of antibodies are going against self, against the things you see on your slide. Primarily, these autoantibodies go after nucleic acids, so that means it's going after our DNA. What happens here is immune complexes are formed, and we know that these circulate and then get caught up, especially in the kidneys with lupus, causing major kidney inflammation. This can also cause problems in the other body systems like the heart, the brain, the spleen, and the skin. Unfortunately, lupus happens more often in women ages 20 to 40 years of age. On your slide, you'll see some of the clinical manifestations of lupus. I mentioned the body systems and how those immune complexes can get caught up and cause problems. A few slides ago, I put a picture of a characteristic butterfly type rash on the face. These symptoms may change depending on the level or attack of inflammation. A positive ANA or anti-nuclear antibody test will more than likely indicate the presence of lupus. However, sometimes with this test there are false positives due to other disease processes that cause inflammation, and positives can be seen even years before any symptoms. There's no cure for SLE or many other autoimmune diseases for that matter. Many times it's just treating the symptoms and trying to keep the immune system calm. So NSAIDs for pain, steroids for inflammation, and possibly immunosuppressive biologics like methotrexate to treat severe cases. Alloimmunity is a third kind of hypersensitivity reaction. This is when our immune system produces a reaction against tissues of another person. So we'll see this in blood transfusion reactions, transplant rejections, or sometimes in the fetus during pregnancy. Alloantigens are also known as ISO antigens. These are non-self antigens from members of the same species. For example, non-self antigens from two humans. There are blood group antigens and histocompatibility antigens, which we will get into. For the blood group antigens, these are red blood cells that express surface antigens. They can be targets of the alloimmune reaction. The ABO blood group consists of two major carbohydrate antigens labeled A and B. These are expressed on virtually all cells. They can be expressed simultaneously, and this results us in having a certain type of blood. The red blood cells of type A express type A carbohydrate antigen. With those with blood type B, they express the B antigen. If we have AB blood, those cells both express A and B antigens on the same cell. In type O, neither are expressed. Know and understand a transfusion reaction. Those who have type A blood will have circulating antibodies to the B carbohydrate antigen. If this person receives AB blood or just B blood, a severe reaction is going to occur. This is the same for type B blood. If they get AB blood or A blood, it is going to attack that blood. Those with type O can give to those with type A or B because type O has no expression. However, those with type O can only get type O because they have A and B antibodies. If you have type AB blood, you are lucky because you can get any of the other 3 blood types. To further go into transfusion reactions, there is an Rh blood group that is also expressed on red blood cells. There are many antigens on red blood cells, but what's important to know here is the D antigen. When someone has the D antigen expressed on their cells, they are considered Rh positive. And on the flip side, those who do not express it are Rh negative. 85% of Americans are Rh positive. You can assume then that those who do not express the D antigen have antibodies against it. So if they receive Rh positive blood and that D antigen is recognized, there may be a reaction. It is very commonly seen in hemolytic disease of the newborn. Moms who are Rh negative do not express the D antigen on their cells. They have antibodies that will attack it. So if the baby is positive, there's a chance that their blood could mix through the placenta at birth. The mom is going to create antibodies against it. If there's another pregnancy and the baby is Rh positive again, this could cause a problem. So after the first birth, mom will actually receive what's called RhoGAM. This is an anti-D antibody which will prevent sensitization against the antigen. So the mom will not attack the second baby's blood. The last hypersensitivity reaction is known as immune deficiency. This is when the immune or inflammatory response does not function normally. There is increased susceptibility to infections. There is primary, which is usually genetic or caused by a genetic defect. And there's secondary, which is acquired, which is caused by another condition such as cancer or infection or even aging. These are more common than primary immunodeficiency. So again, primary immune deficiencies are usually genetic defects. It's a result of a single gene defect. It's usually sporadic and not inherited as a part of family history. About 25% of people with a family history will have it. These mutations occur before birth, but it's depending on the syndrome. Symptoms may show up early or later in life. Some are progressive, appearing in the second or third decade of life. Again, they're rare but somewhat increasing. From 2001 to 2007, there were 30 to 50 cases a year. However, in 2017, there were 354 alone. These affect males and females about evenly, and there were a few major groups of these primary immune deficiencies. Secondary immune deficiencies are known as acquired. These are a lot more common. On page 188 of your text, it goes over some of the secondary acquired immune deficiencies. Know that while they're common, some are not clinically relevant. Sometimes it's very minor and it doesn't increase our risk of infection. Sometimes these are also short-lived. But then there are several deficiencies that include malignancies, immunosuppressive treatments, and AIDS, acquired immune deficiency syndrome. AIDS is an advanced stage of infection that is brought on by a virus, otherwise known as HIV. HIV destroys T helper cells that are CD4 positive. These are very specialized cells that fight infection.